We are not giving up. Our message is still there for persons to become vaccinated, and especially now that we have the new variant.
What's the plan in respect of this vaccine hesitancy?
So I think the program around vaccination has evolved. It has evolved from having shortages, as said earlier by Mr. Mitchell, to having abundance of supplies, to having outlet issues, to having more than enough outlets. And that is evolving into now home delivery and community activation. We are now going to be deploying more mobile units. For example, there are 6 additional units that are coming on stream shortly. We have public health nurses literally doing house to house. We have call-in sessions where persons who are immobile can call their parish public health office and schedule visits for vaccination. And of course, by engaging non-public health officials, private doctors or pharmacies or others, we're hoping that the one-on-one messaging can overcome some of the very objections that Dr. Abraham spoke to.
Any indication that this is working?
Well, you know, it's a trickle. It's incremental, I should say, meaning you're not having a rush except for extraordinary circumstances. For example, the Overseas Work Program. If you get through to go abroad to do farm work, you need a vaccine. There's a rush to get the vaccine. So when you have those compelling reasons that are linked to economics or otherwise, you get that. Otherwise, it's really about convincing persons. And I believe the evolving situation of vaccinate for access, meaning, you know, whether it is for weddings or events, the announcement by the Prime Minister of 50 congregating but vaccination only within the public space, I think will also add to the incentivization. But we do have a lot of work to do because the anti-vax movement is real and some of those fears are real also, and we have to continue to confront them.
Have they won the war?
You know, I think the anti-vax movement has become a lot more powerful and have been underestimated, not just by our local authorities, but by our multilateral partners, our international agencies. Over time, immunization as a concept has been universal and a critical part of our human development here in Jamaica and the world. But over time also, the anti-vax movement have been well-resourced and use alternative media. And I think one of the lessons coming out of this is going to have to be a significant pushback to show the virtues of immunization generally, and in this instance, vaccination to combat COVID, which I think is still the best option.
So in other words, they've won round 1, but we don't accept round 2.
Well, if you want to put it in that way, in some jurisdictions, I believe the anti-vax and the noise in the larger media scape has created some fears, but I do believe that for the most part, most people recognize the importance of vaccination, and we have to continue the push.
We have, as a country, administered about just over 1 million doses of vaccines. Have we given up? Have we given up on reaching the target of 65% vaccination?
Well, I think our target is 100% no in terms of vaccination, and we certainly haven't given up. Every day we are increasing the number of sites that we have and encouraging persons to get vaccinated. Last week we had 274 sites available across the country where people could get vaccinated. So we are not giving up. Our message is still there for persons to become vaccinated, and especially now that we have the new variant, persons need to ensure that their vulnerable relatives, friends are vaccinated so that they will not suffer from any severe disease if this does happen.
With the take-up rate of these vaccines getting lower and lower by the day, how likely is it that you think that we will get to that 65% or even further, the 100%?
Well, the numbers now are disappointing. We see the fall off, and so therefore, you know, it may be that we may not reach that target by March based on the present numbers that we're seeing. But we continue to try, you know, and to get the message out. But based on the present levels that we're seeing, it may be we may have to look at a different date if we're going to put a date on this in terms of achieving that.